All right, now joining us in studio, he used to treat disease in hospitals. Now he prevents them. Dr. Habib Dalhoumi joins us in studio for our health and wellness segment. Good to have you on the show as always. All right, man. So what's new in your world? Keeping people young?
Yes, so 2017 has been great. We're now kind of heading into that season where this is the chance for individuals to focus on the new them in the new year. So like I talked about in the past, body composition optimization. I think with the recent weather that we had that was maybe not quite typical San Diego weather, vitamin D has come up quite big in the new year, and that's something that I was hoping I could talk a little bit about.
So you come around the turn of a new year, New Year's resolutions, I'd feel like you'd be the busiest guy on the planet. Like that's like April 15th for CPAs.
Yeah.
You know, on January, everybody wants to get healthy. You're the perfect guy to talk to because you're doing, I mean, everything from weight to vitamins and I mean, blood work, all this stuff. But yeah, so I'm sure you're seeing an influx.
It's, you know, it's interesting because, you know, the holiday season is the time when we're spending with families. We're spending our dollars on basically things with the family, not quite our own health, and it shows. So come into the new year, we get the excitement. But the truth is, we don't formulate our plans typically till about February or March here in San Diego. So that's when I really see the influx. This is the nice time now, though, where individuals they're prepped, they're excited about getting things going, and so I could take advantage of that and give them good insight.
So we started the year off with a little bit of rain. So we're all deficient of the sun for the first few weeks.
Well, this is the interesting scenario, and this is kind of why I wanted to talk a bit about vitamin D, especially with the recent weather we had, very atypical for San Diego. Surprisingly enough, even in San Diego, there's a good 30 to 40% of individuals that are vitamin D deficient. And that doesn't take into account those that are not vitamin D optimized, meaning that they have good levels of vitamin D, high-end normal levels of vitamin D. Probably only 10 to 20% of the population actually has good levels of vitamin D.
So if you are deficient in vitamin D, what is the side effect of that? What does that mean?
So number one, even having 300 plus sunny days here in San Diego, how can one become vitamin D deficient? We get vitamin D in good levels from sunlight exposure. We can take it orally, we can take it in oral pills, but most of us still don't get good levels unless we are sun exposed, direct sunlight hours a day. And now with the fear of cancers and age-related things related to the sun, we put more sunblock on. We essentially put barriers there so we are not.
So where's the fine line though? You don't want to go out and get scorched, right? But you're saying that some amount of it is actually really good for you.
That's the important part of that. So it's a matter of understanding one's skin tone, skin texture, staying out of the harsh sun rays, but still getting sunlight on a daily basis. It's a hot topic of discussion, but we were designed to be in the sunlight. And staying away from the harsher hours, but still getting daily sunlight, extremely important. And nowadays we have plenty of ways to get supplementation, oral routes, injectable routes. So it's, again, another hot topic.
No pun intended, right?
Yes.
Cheesy, yeah. No pun, okay, got it. So vitamin D, so if they are deficient on it, what does that even, like what would you experience?
This is what you'd ask.
An energy thing? Is it an aging thing? Like what do you identify as a doctor?
So a couple of things. Number one, we call it a vitamin, but vitamin D is actually a hormone, meaning that it's secreted in one part of the body and actually has actions on others. So quite a bit more potent than any vitamin itself. Must be treated more like a hormone, like the hormones we talk about on a daily basis that I talk about. So what that means is that even though it's produced in one area, it has effects on every part of the body. Immune system. In fact, there was an excellent study done in Asia that actually showed optimal levels of vitamin D was better than getting the flu vaccine against the flu.
Wow.
So that's the immune system. Anti-cancer, we know that. Optimal vitamin Ds help prevent cancer. Weight management, we know that metabolism has a big part to do with vitamin D. Those that carry excess fat or those that are obese have lower levels of vitamin D. The mood, so depression, one of the best natural antidepressants. So it goes way beyond just take a vitamin and, you know, because our doctor or you know, the FDA tells us we need to. And on top of that, again, not just taking a supplement to bring your levels into a normal range, but an optimal range. very, very big discussion. When I see patients now, a lot of times they're on very low dose vitamin D, and it's really not doing anything. It's taking a level that's deficient and slightly making it into that normal range, and our hands we're done. No, they need to be optimized to get the benefits.
Interesting. Well, I guess the takeaway here today is get optimized on your vitamin D, not to mention all the other things. I mean, you'll do full blood work and look at every element of what's going on in people's bodies,
Absolutely.
How they're feeling, and you got to sit down with them. I mean, this is medicine has advanced tremendously. You moved out of the hospital because you got tired of treating disease, and
Right.
now all this stuff is kind of preventative.
That's what it is. I mean, instead of just trying to react and prescribe, it's looking at yourself, realizing where there are areas that one can improve, doing as much as you can on your own, and then and optimizing your health.
Well, there's a prevent a disease, and there's also optimizing. You keep using that word, which is living at the best state that you can, the highest
Absolutely.
energy levels, best mood levels. I mean, it's really fascinating. Isn't it moving really fast now? Isn't technology and medicine moving just so much faster than it used to?
It is. This idea of
Crazy times.
regenerative medicine, integrative medicine, it's just that. And when you can optimize your health at every age, you are actually preventing disease.
Unbelievable. Dr. Habib, thanks for coming on the show. I hope you can connect with him online, get to know him, what he has going on. You'll do a consultation with anybody, so you have a few offices here in San Diego. Check him out. I mean, really fascinating stuff. Always appreciate
Thank you.
coming on The American Dream.
Pleasure.
All right, more of the show coming up next.